With the whole of Italy and China on lockdown, the future of the world looks bleak. As coronavirus spreads, Vidello Productions is taking a look at the top 10 COVID-19 coronavirus symptoms and helps you to decide whether you may or may not have the Wuhan flu. Remember to like the video and leave a comment about your thoughts on the global pandemic. Number 10. Feeling tired or exhausted. If you're feeling tired and exhausted, chances are you may have either the flu or the more serious coronavirus COVID-19. The definition of tiredness and exhaustion related to COVID-19 would be that of feeling tired and run down all the time, and not just tired from a hard day's work or lack of sleep. Feeling tired and or exhausted is not usually the first symptom of the virus, however, and will usually appear after a few days after the other symptoms. It's important to remember that other causes include lack of sleep, anemia, heart disease, sleep apnea, diabetes, chronic fatigue syndrome, and hypothyroidism, none of which are associated with a coronavirus. Hypothyroidism alone is very common, especially in women, and affects 27 to 60 million people in the United States alone. Number 9. Loss of appetite. Another symptom, mainly associated with seasonal flu, but also COVID-19, is a loss of appetite, and this combined with a fever is where the phrase feed a cold, starve a fever comes from. Appetite loss often comes with feelings of fatigue, and you may not feel like eating anything, especially if you have COVID-19. Should you have the virus, your appetite will most likely return within a couple of days, and you can easily self-isolate on a liquid diet if necessary. Number 8. Sore throat. Deemed to be one of the first symptoms of the virus, the first signs of your sore throat will be a dry feeling in the back of your mouth. This will not become painful until after a night's sleep and will also force your body to swallow more, often as it becomes more irritating. Long-term sore throats can cause coughs where the mucus swallowed from the back of the throat drops down and sits on the chest. Antibacterial throat lozenges can quickly fight a sore throat, and avoid this if taken early enough. Number 7. Muscle aches. Muscle aches are the feeling of not being able to move or get out of bed, and are common with the type of virus associated with COVID-19. The dull aches when you walk and the overall feeling like you have been beaten up stage, along with other symptoms, could be a sign of COVID-19. It's important to remember that muscle aches on their own can be attributed to many other conditions not associated with COVID-19, and can include tension, overuse, or muscle injury from exercise or hard physical work. Other reasons could be attributed to fibromyalgia, a condition that causes tenderness in your muscles and surrounding soft tissue. Number 6. Coughing. Another serious symptom of coronavirus is the presence of a dry cough that develops rapidly and causes some breathing difficulty. A cough is a reflex action to clear your airways of mucus and irritants such as dust or smoke, and it's rarely a sign of anything serious. Coughs are infectious when a phlegm is produced to help clear your airways. However, with coronavirus COVID-19, this phlegm can actually cause severe breathing difficulties. Mild to moderate coughs usually clear up within 3 weeks and don't require any treatment. However, they can lead to much more serious complications with COVID-19. Number 5. Sneezing. As with all flu-like viruses, it's one of the main ways the virus is transmitted from person to person, both in the air and on some surfaces. Tiny droplets containing the virus can spread as far as 1 meter and can remain on surfaces for up to 24 hours and clothing for longer. Wearing a mask can protect you from both transmitting and receiving the virus. However, it's advised to change it daily and dispose of it in a biohazard safe container. The COVID-19 virus is thought to be caught from either breathing in droplets from an infected person's coughs or sneezes, or touching surfaces with them on. Number 4. Fever. Fever is when a human body's temperature goes above the normal range of 36 to 37 degrees centigrade. Also described as controlled hypothermia, while it's in the safe limit, this is one of the main symptoms of COVID-19. Fevers can be controlled by several methods, including ibuprofen and paracetamol tablets, unless you're allergic, wearing loose comfortable clothing, and avoiding alcohol. Number 3. Breathing difficulties. The latter part of the coronavirus COVID-19 symptoms begin with mild and later severe breathing difficulties caused by the buildup of phlegm in the windpipe. Many people who have experienced the virus firsthand have described this as having to gasp for air or unable to catch a breath. It's important to contact your local emergency room should you have any symptoms like this. Number 2. Pneumonia. Pneumonia is an infection in one or both lungs that is caused by coronaviruses and also bacteria and fungi. The infection causes inflammation in the air sacs in your lungs, which are called alveoli, that fill with fluid or pus, making it difficult to breathe. The symptoms of pneumonia can develop suddenly over 24 to 48 hours, or they may come on more slowly over several days. Other symptoms of pneumonia associated with COVID-19 include rapid heartbeat, sweating, and shivering and feeling breathless even when resting. Considered to be the second final stage of the virus, medical help should be sought immediately. Number 1. Organ failure. Caused by the pneumonia part of the virus, organ failure begins when the virus has spread from the lungs into the bloodstream. Once that blood reaches the organs, it's called septic shock and can be fatal in people over a certain age and also in those with underlying health conditions. Renal failure and respiratory failure can follow shortly after, resulting in death. It's important to remember that out of 110,000 cases of coronavirus, only roughly 4,000 people have died, and many of these were aged over 70 or had severe underlying health conditions. Symptoms not associated with COVID-19. Nausea and vomiting. Both nausea and vomiting are caused by bacterial infections and have absolutely no connection to any type of coronavirus. Nausea and vomiting associated with these infections are much more likely to be caused by something such as E. coli or gastroenteritis. Diarrhea also has many causes, such as stress, bacterial infections, and more, but once again, it has no connection to any coronavirus, including COVID-19. Thanks for watching our video on the top 10 coronavirus COVID-19 symptoms and how to protect yourself. Please throw a like on the video to support the ongoing series, comment down below if you think I missed anything, and subscribe for more top list videos coming soon.